morning, everybody, and welcome to ASA Live. Thank you so much for joining us today. My name is Cindy Morris. I'm the Vice President of Development and Community Engagement at ASA. And we have been talking recently a little bit more about what to expect in our web seminars. And the reason why we're doing this is because ASA is very excited to be able to collaborate with very specific partners to provide content to our members and, believe it or not, our non-members that you can really utilize in your work. This is content that we have been doing virtually since before it was cool to do things virtually. And we are going to continue to do this because we know how special and important it is to be able to gain access to content that can grow your career and really serve you. Today, I have the joy of sitting with Kim Brooks, who is the Chief Operating Officer of Senior Living for Hebrew SeniorLife. Welcome, Kim.
Thank you. Nice to be here.
Thank you. So Kim created and led Hebrew SeniorLife's R3 program that integrated senior housing and care. This effort and this partnership with local health plans was recognized by the John A. Hartford Foundation for their 2021 Business Innovation Award. Before we do anything, let's talk about what the 3 R's stand for. When I was kind of learning about this initiative, I kept laughing, like it reminded me of R2D2, right? So clearly raising some sons who like Star Wars. But let's talk what the 3 R's are. They're right care, right place, right time. Correct?
Correct.
Okay. Tell us about this initiative and how you frame it around those 3 rights.
Sure, absolutely. So thank you. I'm just so happy to be here today, and I love talking about this topic. And you heard about our long name for it. So right care, right place, right time, effectively integrating senior care and housing. And it's really all about leveraging that congregate housing platform and supporting seniors to live their best lives in the place that they call home, where they want to be. We know this is for the most part, where seniors want to be. And we believe that this housing platform, when done right, and when we can add a little bit of services and supports into that setting, we can leverage that platform to help achieve that goal of seniors. And so, we don't always say it's aging in place. We say right care, right place, right time, because it's not always the answer, right? But for a long time, and in many cases, it can be the answer to live independently for as long as possible. And then in some cases, a transition is warranted, but it's really about supporting people to live their best lives in that right place.
It's interesting as I'm hearing you describe it. A lot of people who have listened to our ASA Lives over the last couple of years, they know that I'm new to aging. So part of the fun of this for me is that I'm learning constantly from you. And I learned this idea of it's not necessarily about aging in place, but there is such a benefit to aging in community. And that's what I feel like you're really digging into here, is that aging in community concept. Exactly. Is that what led to the development of this, or what led you to develop this program overall?
Yeah, so I'll tell you, the 3 main components of the model are the wellness teams, embedding wellness teams into housing, and I'll talk a little more about all the interventions that they're doing in a minute. And then a real partnership with anyone and everyone who's involved in a senior's care. So it could be their physician, the local area agency on aging, all the community-based providers, the health plan, and then really figuring out the payment structure is the other main component. And, figuring out how we shift some of the dollars that are spent on the back end at the health plan level over to the housing side, where we can do some of these preventative services and really have impact. At its core, it's about embedding this wellness team, which for us has included a wellness coordinator who's a social worker and a wellness nurse, into a group of affordable senior housing sites. And letting them work closely with the on-the-ground team, which might be the maintenance person, property management, a resident services coordinator, and putting interventions in place that help solve some of the challenges that we might identify through a series of assessments, risk stratification, and then putting all that in place to really help people live successfully in that setting and close those gaps. So, that could include proactive wellness checks, medication adherence, health education on certain chronic disease areas, and just connection to services and support. So hopefully that gives you kind of a general sense, and then I'm happy to talk about, if you want, kind of how we came to develop it in the first place.
Yeah, talk to us about that, because hopefully this is something that people can replicate within their own work.
That's the hope. I mean, we knew that housing was an important part of the senior care infrastructure for a long time. And we had been in discussions for years with health plans who said, they got it and they kind of believed it, but they really needed proof. They wanted evidence. Mm-hmm. They wanted to really have that evidence base to know that it was making a difference. And then, excuse me, there's just so many challenges inherent in that. The health plans often don't have critical mass in any one building. So even though we might have 200 seniors living in one congregate housing setting, they have a whole host of different health plans. Some are in managed care, some are in fee-for-service. So there's no critical mass to motivate a health plan necessarily to really partner with you at a deep level. And then there's also, not a lot of clustering that happens. So you have multiple care managers, all different agencies providing personal care. Not a lot of streamlining between the healthcare world and the housing world. And then, as we said, no proof, no tracking, no metrics, no measures. So about 5 years ago, we were very fortunate to be funded through an innovation grant of our Massachusetts Health Policy Commission here in the Boston area. And they funded us to design an intervention and then measure it and really do a full evaluation of it. So through a series of really great partnerships with a lot of local providers here, we set up that demonstration. We rolled it out over the last few years, and then we had a thorough evaluation of it.
So what are the outcomes that you're really seeing? What changes are you getting into with this?
I mean, it's everything that you would hope to see. At the resident level, it's satisfaction with life, satisfaction with the program, a greater engagement in their well-being and, activation around their own care management, more days at home, which is what they want, less in the hospital, less in long-term care, more at home. For the staff, it's about being part of something bigger and having impact at a very different level, knowing that the changes they see and can communicate really can make a difference in someone's life. And then the overall healthcare system impact. So reductions in things like trips to the emergency room, hospitalizations, all of those we measured not only for our intervention group pre and post, but we also were able to measure them against a series of comparison sites. So could get a true read on how the program was, was working. And certainly inherent savings in the long-term service and support system. We know that about a third of the people living in these settings would otherwise be in nursing homes. So through that evaluation from our partners at the Long-Term Service and Support Center at UMass Boston, we were really able to measure and prove those out. And then I guess I'll just mention one more. One of the outcomes we're most proud of is that closing of the gap and the, identifying, like we found risk areas like mental health, cognition, nutrition supports, food insecurity. And, we were able to identify all the people at risk in those areas and actually not just make referrals, but put services in place that really made a difference in over 90% of those risk areas. So those are the kind of things that we were able to achieve.
Yeah, as I'm listening to you, I think that what I'm hearing you, the way I love it, first of all, I said, what are your outcomes? And you said, well, from the older adults perspective, right? This is why this mattered. And at its core, when the first outcome that you're addressing is the experience of the client, and the experience of the actual person using these services, I love that, because I'm hearing you say there's real financial impact to this where it's saving money, and there's very real, um, impact to the way our staff gets to interact and work. And I appreciate those things, right? But what you just said is probably what I'm saying, right? Is that but in reality, we're able to work with older adults and get them the services they need, get them into the spaces that they're going to thrive in, and provide those resources. And the impact of that is that they are appreciative and feel a
Mhm.
more full life. And I think that should be the center of what we are all aiming to do. And I love that that's the center of what your outcomes are, right? Um,
Thank you.
what are your next steps in this? You've been doing this now for a few years at this point. um, how do you grow this? How do you improve it? What do you want to see next?
Yeah, I mean, we've been trying to leverage that value that we created. We just talked about those trusting relationships that residents have, the value to the health plans and the care partners who can leverage this efficient team to reach a lot more people, faster, easier, more effectively, based on those trusting relationships. And so, now it's about what do we do with that? So we're very focused on replication and sustainability.
Okay.
And just to clarify, our goal is not that we HSL are doing this everywhere for everybody in every location. Our job has been what we've been very focused on is figuring out how do you prove it out, how do you then help others replicate it, how do you get that sustainable funding model in place so that we can reach the million plus seniors across the country that live in this setting. So locally, we do believe we can replicate. We have been able to continue on with the 7 sites that we were in from a demonstration standpoint. We've already added an 8th, and we're contracting with 2 more. That'll get us up to 10. So that's been great. And then, we'd be happy to, and we're looking forward to playing a role if there is one in being a technical assistance provider or, helping others with the tools and the resources and kind of the replication model to get it going in other places. And then very focused on funding. So, partnering with and contracting with more and more health plans to get them paying for the service. And then looking at a broader kind of statewide funding mechanism that would just build it into the funding infrastructure so that everybody doesn't have to work with so many different plans to make it work.
I love this. The web seminar that's coming up on the 10th of February is really it's part of our series with the Aging and Disability Business Institute that is part of US Aging, and this webinar is taking the award winners of the John H. Hartford Foundation's Innovation Award and really diving into what are the programs that were in place and why were these awards won, and then how do we replicate, right? Um, and and what's exciting to me as I listen to this is that I spent years working in nonprofits, and there's no reason to constantly be reinventing the wheel. What I'm hearing from you is there's a way to make this profitable. There's a way to bring these services out. And whether you are working for a for-profit business or a non-for-profit, being able to take this type of program and repeat it is wonderful. And I'm really excited that we're going to be able to listen to these other programs that are going to be discussed again on the 10th. We're going to be having the executive director of Daybreak, who is going to be talking about a program that they ran. We're also looking at talking to Christina Mernares, who is the community service manager where she works, to talk about how she's working on long-term services and supports for older adults. It's very exciting to me to hear a program that is truly, I was about to use a made-up word, but can truly be replicated would be the right way to say that. So I won't use a word that I'm just going to make up, like replicatable. So let's, last question I really want to hear from you are, what are the lessons you learned? Because this is where we get into, right? What have you learned? What were the mistakes you made? What was the thing you wish that you didn't have to go through that step? What have you learned in this process?
Yeah, we've definitely learned a lot. One of the big ones is that just measures, metrics, accountability, they're really important. I mean, doing great work is all good, but you have to be able to show outcomes. And if you're going to really engage in, as a community-based provider, a housing provider, if you want to engage and be at the table with a health plan, you really have to, you have to align goals. You have to understand what those key indicators are and those drivers, and you have to work towards them, and you have to be able to measure against them, and hold yourself accountable to really being part of that value chain. So I think that's been a big one. And then I guess along those lines, when you ask, like, what have you been surprised about? I think, we thought we'd come along and, everything from accountable care organizations to hospitals to health plans would just respond in a minute because this just had so much value. But there's a lot going on out there, and you really have to be so persistent and be willing to just kind of push the existing models and infrastructure and push back on what's out there now, and be willing to kind of take a chance and be very persistent to get in front of people. And I guess the other one I would say is just remembering why we all do this work, and again, achieving great outcomes in ED reductions and all that is good, but the real reward is when you talk to a resident in senior housing who is just so settled and feels good about their life and is happy to be able to be where they are and stay home and be activated in their own care.
Yeah, I love that. There's nothing like designing a program from the perspective of the user. And it feels really good that that's where your focus was, and probably is the very number one reason why you've had such success. So congratulations on that.
Thank you.
Thank you for joining us, Kim. This was super fun for me. I really learned a lot. I hope that people will take this taste and then jump in with us into the deep end on February 10th webinar. You can easily sign up for these on our website, asaging.org. But kind of, this is just a taste of what it's going to be. And you're going to be able to really learn about a few more of these programs that will really help and assist you in your own work. And of course, also earn CEU credits for that. Alas, we're not giving out CEU credits for our ASA Lives, but they are available for our web seminar. And I think that the value of that is really important. So we hope you'll join us again on February 10th. And Kim, thank you so much for being a part of this with us. I hope maybe we'll see you at On Aging, which is coming up in just a couple of months in April. So also just a reminder to everybody that registration is open. So if you are looking at really how to learn the most in kind of a compressed couple of days, while also just having a blast and getting to see all of your friends and colleagues in aging, we hope you'll join us in New Orleans. The vignettes are there, and I cannot wait to eat them. So please join us. That's April 11th to the 14th. And also you can register for that at onaging.org or right on our website. So please, please, please join us, and we'll see you all soon. Thanks
And I'll
so
see
much.
you there. Thank you. Thank you very much for having me.
Thanks, Kim.